Earlier this week, WFMY News 2's Maddie Gardner had a one-on-one with North Carolina's Health and Human Services Secretary, Dr. Mandy Cohen. And now it is your turn to hear from her one-on-one. She joins us today to talk about the state's rollout process, the ways that you get your vaccines, questions all to be answered. Dr. Cohen, thank you so much for joining us. We appreciate it.
Great to be with you.
All right, so let's jump right on in. The first thing let's talk about is the place that you guys have set up so that people can take a look by their zip code and simply figure out the easiest, quickest place for them to get their vaccine, and also to figure out what group they're in.
Right. Well, first, there's a lot of places to get information, but the one you should remember is yourspot.nc.gov. That's the main site, and it'll take you to these other places I'm going to talk about, but it's yourshot.nc.gov. Has lots of information, both about the vaccines itself and are they safe and effective, but also about what group you may be in and the prioritization, as well as finding those vaccine providers. So you can go directly to a tool that allows you to put in your zip code, and it can bring up all of the providers in your area, and you can be and search easily. It's called myspot.nc.gov. But again, you can always go to yourshot.nc.gov, but also myspot.nc.gov has that tool to find the location. You can also find what group you are in. Again, we had to prioritize how we were rolling out this vaccine because so many people want it, which is great, but we have such a limited supply. So we do have to break things up into groups. We are vaccinating those who are over the age of 65 and older right now, as well as healthcare workers. But if you want to find out your group, you can go to findmygroup.nc.gov. You answer some questions about your age, about where you work, and some other questions, and it'll sort you into groups. And importantly, you can leave your contact information, and if there's any update, it can preview for you when we are moving to the next group. So good opportunity for you to leave your contact information, and you can keep getting updates from us.
Okay, so that is the great starting place for all of you at home to look for where it is zip code wise and what group you're in. We put that in the 2 wants to know section as well, so it's like easy one-stop shopping, and all you have to do is click, click, click to get to each one of those things. So Dr. Cohen, let's now talk about that hotline that you guys have set up, and you've expanded the times as well for people to call. What kinds of questions can they ask when they call that hotline?
Sure. So we do have a hotline now. It's 1-888-675-4567. And we have expanded capability for that hotline now. So you can always ask questions about the vaccine itself in terms of what's available. They can also help you with finding a vaccine location. They can help you know what group you are in, and then they can answer other questions that you may have about the vaccine. The one thing it does not do, it's not a place where you can get an appointment. It can tell you what the vaccine providers are in your area, but that is not a number you can call to get an appointment. But basically all of your other questions can get answered there.
So if people, like, for instance, had a question about, I'm taking this kind of medication, am I able to get the vaccine, that kind of thing, would they be able to ask those kinds of questions?
Well, I would say this isn't a medical advice line, so I would talk to your doctor or your healthcare provider about specific questions you may have about you and the vaccine. I would say there are very few reasons why we would say you couldn't get a vaccine. Very, very severe allergies. Even then, folks are saying, do get the vaccine, but we want to monitor you closely. So there's almost very, very, very few reasons why we'd ever say don't get the vaccine. So most of the time, the answer is going to be go get the vaccine.
Okay. All right. We've had a couple of people reach out to 2 Wants to Know saying, hey, I'm getting this weird email about a vaccine portal, and I'm not really sure if it's real or not. So we want to show folks the video of the actual email so that they'll know, hey, if this comes into your inbox, this is kind of what it looks like. It talks to you by name. It talks about the vaccine management system recipient portal, and it gives you a way for you to log on. So tell us what this is all about.
Yes, so we do have an online portal, but this is only once once your group is available and you already have an appointment. you may be sent an email to ask you to pre-register, to give information about you, to help you, so when you arrive for your appointment, it goes a little quicker. So that's the reason for the outreach from the portal. But again, usually that happens only after you have an appointment and your vaccine provider has sort of sent you that information, so you can upload some additional information. Again, it cuts down on the time that you may have to give that information when you first arrive. So so there would be email contact, but you do not need to have an email address to get a vaccine. That's just some extra help to ease the process. You can always give that information when you arrive for your vaccine appointment and at that moment. So the early information you put into the portals just to help speed things along.
Just like you do before you go to the doctor and they want you to fill all that stuff out before you ever get there. Same kind of thing. And it's a great point that you make, that you don't have to get that email to get a vaccine. That's a great point to make sure that all of you know that at home.
Correct.
All right, Dr. Cohen's going to be with us until 6 o'clock answering your coronavirus and vaccine rollout questions. You can text them to us, 336-379-5775. Remember, this is text only, so do not call. We will be right back.